What happens to your prostate? When you masturbate regularly after 50, you won't believe this. Did you know? Men who ejaculate 21 times a month reduce their risk of prostate cancer by up to 33%. Before we begin, don't forget to like, share, and subscribe if you care about your long-term health. Your support helps keep critical conversations like this alive. And hey, drop a comment below. Do you think self-pleasure could be part of your healthy aging strategy? Welcome to today's deep dive. What happens to your prostate? When you masturbate regularly after 50, imagine waking up at age 60 and feeling stronger, healthier, and more confident down there than you did in your early 40s. Sounds impossible? Not quite. While society constantly tells us that aging means inevitable decline, dropping testosterone levels, chronic inflammation, urinary issues, or even prostate enlargement, the truth is far more empowering. What if we told you that one simple private act could help protect your prostate, enhance your sexual function, and even lower your risk of prostate-related diseases? Yes, we're talking about masturbation. But this isn't some cheeky late-night topic. It's a scientifically supported, medically relevant discussion that could change the way you approach your health as you age. Today, we're diving deep into the unexpected connection between regular self-stimulation and prostate vitality, especially for men in their 50s, 60s, and beyond. Call to action. Before the deep dive, before we continue, don't forget to like, subscribe, and hit that bell icon if you're ready to take control of your health and discover what truly works. Not myths, but science. Let's break down what actually happens to your prostate over time, and why your hands might just be the most underrated tool in maintaining its health. The prostate, a silent guardian that ages with you. Your prostate is a walnut-sized gland that plays a crucial role in male fertility. It produces the fluid that nourishes and transports sperm. But as you age, especially past your 40s and 50s, this gland starts to undergo changes, some of which can lead to very real problems. Benign prostatic hyperplasia, BPH, chronic prostatitis, even prostate cancer. These are not just statistics. They're realities for millions of men. Dr. Abraham Morgentaler, a urologist and author of Testosterone for Life, explains that by age 60, more than 50% of men experience some form of prostate enlargement. But what's often overlooked, he notes, is how lifestyle, including sexual activity, can directly impact prostate health. The science behind masturbation and prostate function. According to a 2004 study published in the Journal of the American Medical Association, JAMA, men who ejaculated more than 21 times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times monthly. Why? Regular ejaculation may help flush out carcinogenic substances from the prostate and reduce the buildup of prostate fluid, which, when stagnant, can become a breeding ground for inflammation. Moreover, self-stimulation promotes blood flow, strengthens the pelvic floor muscles, and helps regulate hormones that support prostate tissue integrity. And unlike sex with a partner, masturbation offers complete control, meaning it can be done at your own pace, with your own preferences, and without performance anxiety. Real-life examples that break the age barrier. Consider John, a 62-year-old retired firefighter from Florida. After struggling with mild urinary issues and nighttime urgency, his doctor suggested 2 things: pelvic floor exercises and maintaining a regular ejaculation schedule. Within 3 months of practicing Kegels and masturbating 3 to 4 times a week, John noticed a significant improvement in his flow, sleep quality, and even libido. "I felt like I had reclaimed a part of myself that I thought was gone forever," he said. Or take the case of 58-year-old Dr. Alan Rice, a naturopathic physician who began advocating for conscious masturbation as part of his male patients' wellness plans. "It's not about lust," Dr. Rice explains. "It's about circulation, hormone balance, and giving your prostate the stimulation it needs to stay active and resilient." Breaking the taboo. Why it's time for men to talk openly. Despite the mounting scientific evidence, masturbation remains a taboo subject for many older men, often clouded by guilt, religious views, or outdated beliefs that it's harmful or shameful. But from a physiological standpoint, suppression of natural sexual function may do more harm than good. Dr. Michael Eisenberg, director of male reproductive medicine at Stanford, points out that sexual activity, whether solo or with a partner, is a reflection of overall health. When a man loses interest or capacity, we often find underlying medical issues that need attention. So if you're healthy enough to do it, and especially if you're not sexually active with a partner, masturbation can serve as both a diagnostic indicator and a therapeutic habit. What happens to the prostate? Over time, when you masturbate regularly, let's break it down chronologically. Within 1 to 2 weeks, you may notice improved pelvic circulation and a slight reduction in nocturnal urination. The prostate starts benefiting from the rhythmic muscle contractions during ejaculation. After 1 month, regular self-stimulation helps reduce prostate fluid stagnation. Inflammation markers may begin to lower, and pelvic floor tone improves, especially if paired with exercises like Kegels. After 3 to 6 months, men often report better control over their bladder, fewer instances of discomfort during urination, and a noticeable boost in confidence and mood, thanks in part to the dopamine and oxytocin released during orgasm. Beyond 6 months, over time, prostate tissue remains more elastic and functional, potentially reducing the risk of BPH and chronic prostatitis. You might even notice more satisfying orgasms and a better connection to your body. This isn't fantasy, it's biology. The takeaway here is that masturbation, when practiced mindfully and in moderation, isn't just a guilty pleasure. It's a form of self-care, a biological maintenance practice that every man should understand and consider, especially as he ages. So the next time someone tells you that aging means losing your edge, you can tell them this: science disagrees, and so does your prostate. Before we jump into the shocking benefits by timeline, smash that like button if you're ready to hear health advice no one talks about. Subscribe and turn on notifications so you never miss deep science-based health truths. Week-by-week timeline of prostate changes. Week 1. Blood flow boost begins. Fact: poor pelvic circulation is a hidden driver of prostate disease in men over 50. In just the first week of resuming or beginning regular masturbation, you may start to notice small shifts, especially if you've been relatively inactive sexually. Why? Because the act of self-stimulation triggers vasodilation, the widening of blood vessels in your pelvic region. This increased blood flow delivers more oxygen and nutrients directly to the prostate gland. Scientific insight. According to a 2016 article published in the Aging Male, improved pelvic blood circulation is directly associated with tissue regeneration and reduced fibrosis in the prostate. Practical example. One 64-year-old client of a urologist in New York reported fewer nighttime trips to the bathroom and more full erections just 2 weeks into a routine of masturbating every 2 to 3 days. Personal take. Think of it like changing the oil in a car. When the fluid circulates regularly, the engine stays clean and functions efficiently. Week 2 to 3, inflammation reduction kicks. Did you know stagnant prostatic fluid is a breeding ground for chronic inflammation? The prostate secretes fluids constantly, but without regular ejaculation, these fluids can build up, causing pressure, discomfort, and eventually inflammation. That's why around the 2nd or 3rd week, you might start feeling less pelvic tension, fewer aches, and a general improvement in urinary flow. Science says, a study in JAMA, Journal of the American Medical Association, linked frequent ejaculation with a lower risk of chronic prostatitis, a painful condition involving inflammation of the prostate. Expert opinion. Dr. Ranjith Ramasamy, a leading urologist, notes that regular ejaculation may help remove irritants and reduce inflammation in the prostate microenvironment. Personal take. It's like draining a bathtub. If you leave water sitting, mold builds up. The same goes for fluid in your prostate. Week 4 to 5, hormonal reset and mental clarity. Fun fact, orgasms trigger the release of endorphins, dopamine, oxytocin, and prolactin, all of which directly affect prostate health. By now, something fascinating happens. You don't just feel better physically, but emotionally and mentally too. When you ejaculate, your body releases a wave of hormones: endorphins, natural painkillers and mood lifters; dopamine, pleasure and motivation; oxytocin, the bonding hormone that lowers cortisol; prolactin regulates sexual satisfaction and rest. These hormonal shifts reduce stress, which is critical because stress increases systemic inflammation and hormonal imbalance, both enemies of prostate health. Study highlight: in a 2018 review in Endocrinology and Metabolism Clinics, researchers concluded that hormonal shifts post-ejaculation might contribute to lower systemic cortisol and better immune function. Real-life case: a 58-year-old therapist reported better sleep and less anxiety after integrating mindful self-pleasure twice a week into his routine. Personal take: many men chase supplements for testosterone balance, but your body already has a built-in system. Use it. Week 6 to 8, prostate congestion clears. Warning: chronic prostate congestion can lead to benign prostatic hyperplasia, BPH, or even long-term discomfort. Around the 6-week mark, if you've maintained a healthy routine, your prostate begins functioning more efficiently. This is when congestion clears, ducts stay open, and fluid doesn't stagnate. Biological explanation: regular ejaculation prevents the accumulation of seminal plasma, reducing the likelihood of duct obstruction or calcification. A 2021 European Urology study suggested that men who ejaculate frequently in midlife had a lower incidence of BPH symptoms later on. Personal take: think of this phase as a detox for your reproductive system. When fluids keep moving, the system stays clear and efficient. Week 9 to 12, comprehensive prostate renewal. Fact: the prostate is capable of rejuvenating itself, especially under favorable hormonal and circulatory conditions. By the 3rd month, something profound happens. All the benefits: circulation, hormone balance, inflammation control, congestion prevention, start to synergize. You might experience stronger and more consistent urinary flow, less nocturnal urgency, fuller, more satisfying orgasms, reduced pelvic pressure, more energy and clarity. Cellular science: improve blood flow and hormone balance, help maintain telomere length in prostate cells. This means slower aging at the cellular level. Personal take: you're not just maintaining function, you're reversing wear and tear. This isn't pseudoscience. It's biology at its most elegant. The dark side of overdoing: not all stimulation is healthy. Like anything, moderation is key. Too much of anything, even something beneficial, can backfire. Genital irritation from frequent friction. Fatigue or loss of motivation if it interferes with sleep. Guilt or anxiety, especially in men raised with negative beliefs about self-pleasure. Expert reminder: the Mayo Clinic notes that while masturbation is normal, if it causes distress or interferes with daily function, professional guidance may help. Personal take: don't turn a wellness ritual into an addiction. Use it for health, not escape. If you found these insights surprising or useful, now's the time to like, share, and subscribe. Comment below with your thoughts. Do you think regular masturbation can be a form of prostate therapy? Final summary: what happens to your prostate when you masturbate regularly after 50? Let's wrap up the main takeaways. Week 1, circulation improves, nourishing the prostate. Week 2 to 3, inflammation reduces, easing discomfort. Week 4 to 5, hormones balance, mental clarity sharpens. Week 6 to 8, congestion clears, ducts remain open. Week 9 to 12, a holistic transformation emerges. In essence, this natural private act becomes a biological maintenance tool, keeping your prostate youthful, functional, and disease-resistant. Regular self-care isn't just about pleasure, it's about preservation. As you age, you need to work with your body, not against it. Thanks for watching today's deep dive. If you're passionate about breaking health taboos and uncovering real science, smash that like button, subscribe, and share this video with someone who needs to hear it. Your voice matters. Leave a comment with your personal experience or questions about today's topic. Stay curious, stay informed, stay empowered.